When I first went to the mobile unit to get seen, I was very scared. I was worried, I was stressed, I was worried about what could happen, the possibilities of if I did end up with cancer, what's going to happen to me, what's going to happen to the kids.
Well, first I remember laughing but it wasn't an outside laugh, it was more in my head. And I thought, oh my God, I'm so in Texas, because the lady, I don't know if it was a nurse or whoever it was, but she called me and she said, we got your pathology report back and it is the cancer. And I just remember hearing, the cancer. And I was like, oh. And then I was like, holy cow, wait a minute, she's talking about like cancer in my body. So it was pretty overwhelming. It was complete like paralyzing fear. And I remember trying to talk to my dad and tell my dad, and I couldn't even say the word.
My biggest fear through everything was knowing that my cousin at 35, who was only 4.5 years older than me, just passed away of breast cancer. That was my biggest fear because, you know, I'm 30, I'll be 31 in August, and I never thought that cancer would be something that I would have to worry about. I don't want to wait until the last minute, until it's too late. I wanted to get something checked out, and I wanted to get it checked out then.
Can you imagine a woman laying in bed one morning and feeling a lump somewhere, her neck, her breast, her abdomen, and going, what is that? Who will I call? How can I trust that person? That person doesn't speak my native language. How will I afford it? Can you imagine living with knowing something's wrong with you or suspecting something's wrong with you and not knowing where to turn and what resources to get? A lot of these women are very anxious. Even the well ones come in very anxious.
Our patients come from all walks of life. They may be culturally isolated, they may be uninsured, they may have recently lost a job and just don't know where to turn. And so our mobile program and our mobile units are easily accessible by women in these situations.
We do all kinds of screening on the mobile. What we do a lot of is screening mammograms. Women who basically just want their breasts checked, not because they necessarily have an imminent problem, but because they just want to know everything's okay, because that's the beauty of screening mammograms, is we find something early before there really is a problem. They also have complete head-to-toe physical examinations. They're getting their weight, their blood pressure, they're getting their blood drawn, they're getting examined head-to-toe, including breast, pelvic exam, pap smear, rectal examination. Whatever a woman needs, she gets a comprehensive physical examination.
The nurse practitioner that saw me was probably the most supportive, calming person. She saw that I was really, upset, and I was very adamant about this, and she saw that I had a history of breast cancer in my family. She saw all of these factors and why I was upset, and instead of, blowing me off like most places would for me being so young, she made me feel really comfortable, told me, I didn't have anything to worry about, that if there was anything that they were going to find it.
The whole focus of the mobile program is early detection and prevention. That's what we do. We don't treat the blood pressure, but we find it out before it goes into heart disease. We don't treat the diabetes, but we find out as the blood sugar is rising before they start getting into complications with their eyes or their kidneys or their circulation. It's so much easier on so many healthcare problems to treat it early rather than late, because then a cure is possible.
We're an access point for many people into the healthcare system. We are moving beyond screenings and into more of a population health. And for the individual, that just means we're talking to people about maintaining their good health and preventing progression for chronic disease such as diabetes, obesity, heart disease, and talking to them about how to find a medical home and get a regular doctor that they see for themselves and their families.
it not only was, I guess, a relief that I went through this process and found that I was okay, but I feel more educated coming out of it than I was going into it, because, now I know what to do and where to go and who to talk to and who to see and what to look for, and what should be a concern and what shouldn't be. Whereas before, I felt kind of lost. I don't feel like there's enough, education out there.
In a perfect world, we wouldn't need a service that travels into the community to break these barriers, but we do. And every patient, every person should be able to access our healthcare system easily and not fear the system. But we do have patients that live in those situations in the community, and our service is vital to being able to break those barriers, to teach people, give them the tools that they need to advocate for themselves through this very complicated system that we have.
I just feel so blessed that I was here in the Metroplex and that Kupferle was here, and that there are organizations like this out there that provide this service for women, who don't have insurance and need to have the care.
Somebody out there, I don't know who, but somebody donated money, and because of that, I can sit here comfortably knowing that I'm going to be okay, and my kids are going to be okay. You're making a huge difference in somebody's life, and you don't even know.
A few weeks ago, I was having a bad day on the mobile. It was already a rough start of a morning. We got to a site a little bit late. My first patient comes in, and I knew that I had to kind of get my decorum and take care of her in a professional and appropriate and kind way, but I was frazzled. She stopped and she grabbed my face and she said, "Muy amable." In Spanish, "muy amable" means "you are so kind." And I started to cry immediately because, I had come in a little stressed. And for someone to say, "I am so kind," but the thing about that I thought immediately was, I am not so kind. It's the women and the men who give me this money to come on this mobile, to give you this service, to make you feel well. I am not so kind. It is you that is so kind to give me the resources to take care of this woman. Muy amable. You are so kind. Muy amable.